Hello, my name is Nilu, and here's my assessment kit. First thing is the table of contents. First assessment we have is anomia. Here are the directions. Here are my 5 pictures of famous people: Dr. Martin Luther King Jr., Vice President Kamala Harris, Leonardo DiCaprio, Albert Einstein, Princess Diana. And then inside we have a hairbrush, eyeglasses, a wristwatch, a pencil, and a key. Common household items. For the next one, we have ahalagnosia. Here are the instructions. And inside we have a piece of velvet, cotton rounds, a wooden block, and rubber. We have amorphagnosis for the next one. The instructions. We have a circle, square, rectangle, star, triangle, and a wooden block. Next we have color anomia. Here are the instructions. We have black, orange, red, yellow, blue, and green. Next we have stereognosis or astereognosis. Here are the instructions. And we have a key, a screw, a fork, a toothbrush, a pen, and a coin. Next one we have is agnosia. Here are the instructions. We have a key, pen, eyeglasses, a paper clip, and a coin. Next we have is color agnosia. Here are the instructions. And I went to Daiso and I got these fruit. So I have blackberry, peach, and orange, a red strawberry, a peach, and then I have 2 different colors. I have one blue banana and I have a pink or a purple cherry. Next I have constructional praxis. Here are the instructions. And what I did was I have one that is already made right here, and then I have the corresponding pieces so that the patient can copy this example. I have form constancy next. Here are the instructions. I have a paper plate, scissors, a fork, a doorknob, and then I have three photos of shapes, three cutouts of shapes of different sizes but the same color. Here are the squares, the circles, small, medium, big, and the triangles, all in the same color. Next one that we have is prosopagnosia. Here are the instructions. I have a mirror. And here are the famous people. So I have Oprah Winfrey, Will Smith, Marilyn Monroe, Jennifer Lopez, President Joe Biden. Next I have visual acuity near and far. We'll do the near one first. Here's the instructions. Here's the lighthouse chart. For the far, here are the instructions. Here's the Snellen chart. For simultanagnosia, here are the instructions. And here are pictures of people. So this are people at a restaurant, people at the beach. This is in Paris in front of the Eiffel Tower, two parents having a picnic with their daughter. And this is Disneyland, and there's a parade and a show going on. Next we have pupillary size. Here are the instructions. And here's the pen light. Next we have range of motion. First we have AROM. And here's the second page to AROM. And then I have this little cheat sheet. So I have all the motions, their degrees, the types of goniometer to use, and then the ADLs that correspond to those motions. And then I have PROM, passive range of motion. And here are the goniometers. Next we have saccades. And here are the blue and red stick. Next I have gustation. Here are the instructions. And then I have citric acid, I have sugar, cocoa powder, and salt. Salt, cocoa powder for bitter, citric acid for sour, and sugar for sweet. And then I have the little cotton swabs. Next we have olfaction. Here are the instructions. Now we have mint extract on some cotton swabs, a cinnamon stick, coffee grounds, and vanilla extract on a cotton swab, cotton round. Next we have audition and vibration. They both require a tuning fork. And here's the tuning fork. Next we have sharp, dull discrimination. And then I have an eraser. And I have paper clips and a safety pin just in case. Next I have temperature. Here are the instructions. And then I have 2 hot and cold packs, one you put in the microwave and one you can keep in the freezer. Next we have 2-point discrimination. Here are the instructions. And here's the aesthesiometer. Next we have tactile localization. So for this one you can just use a fingertip. Next one is light touch. And I have 3 cotton balls and cotton swabs just in case. Next I have the Wong-Baker Faces pain scale. Here are the faces. Next I have circumferential edema. Here are the instructions. And here is the measuring tape for that. And then lastly, we have an occlusion mask for any of the assessments that require the patient's eyes to be closed. And then we have a dermatome chart for any assessments that require a dermatome chart, such as light touch discrimination. I have the hands and then the entire body. And that is my assessment kit. Thank you for watching.